Welcome, folks. Some of you are seeing me for the third time today, so I appreciate your patience and tolerance for my voice. I am really glad to see folks continuing to engage in conversations throughout Children's Advocacy Week and throughout the day today. We're really excited to have our fantastic panelists here to talk about their experience in advocacy and in lobbying from their different perspectives. And I have a feeling we will learn a lot and get some really insightful information from our folks on this panel. So I know that folks will continuing to be engaging and being added to the Zoom, but I think we should go ahead and get started. And then as folks jump in and catch up, they can go back and revisit the conversation as well. So I always forget to introduce myself. I am Shannon Moody with Kentucky Youth Advocates. Kentucky Youth Advocates, if you are not familiar, is a nonpartisan policy advocacy organization. And we work with these fine folks who are our panelists pretty closely, especially during the legislative session, and are really excited to have their expertise and experience brought to the table so that you all can learn from them. So there are opportunities to drop questions in the chat. Please do that. Raise your virtual hand and unmute yourself when we do the open Q&A, but we will go ahead and get started. We're going to have our lobbyist Frankfort Insider panelists introduce themselves. And if you would, please go into a little bit of detail about what you do within your role within the organization or agency that you work for, and then we'll pass it to the next panelist. So we've got Shane, Liz, Shannon, and Ashley all joining us today from different entities. And why don't we go ahead and start with Ashley and then hear from Shannon, Liz, and Shane.
Sure. Thanks for having me. My name is Ashley Christensen, and I do government relations for the Heart Association currently. But I've done work in the criminal justice space. I'm an attorney by trade, and then have kind of found my way into the advocacy world. So, I think the two worlds collide in a lot of ways, as I know you guys know better than anybody else. But I mean, so right now it's healthcare, but then also criminal justice, and that's what I'm doing these days.
Hi, y'all. I'm Shannon Baker. I'm the Director of Advocacy for the American Lung Association in Kentucky and in Tennessee. So that just means I spend my time talking about policy initiatives related to lung health, both in Frankfort and in Nashville. And I started my career as a lobbyist right out of college, so about the same age as some of the folks on this call, maybe. And I went to work on Capitol Hill for an internship when I was a junior in college and got Potomac fever. And so the day after I graduated, I went back to Washington, D.C., and I did federal work on Capitol Hill for a member of Congress for a while. And then I figured out that I really liked kind of the advocacy role. And I went to work for a trade organization in DC, was later hired by one of the members of that organization and did federal, state, local, and international lobbying for them for a number of years. And fast forward to over time and over family, I landed here in Louisville, Kentucky, and found my way to the Lung Association. And so what I like to say is I now get to do what I really love to do, but for a cause that makes a huge difference. And so lung health in Kentucky, as you all know and can well imagine, is such a relevant and important advocacy space. And I'm happy and privileged, I think, to be able to work for the Lung Association. And thank you for inviting me today.
Oh, I'm next. Sorry about that. Hi, everybody. I'm Liz McQuillan. I'm the Chief Policy Officer for Metro United Way, and really excited to work along several of the partners here. My sort of advocacy journey started, I worked in local government. I worked for the Louisville Metro Council for several years. And that I feel like gave me such a good landscape into, the legislative process, politics, and then sort of, the organizations that are really involved with services in the city. From there, I went to Greater Louisville Inc., the Metro Chamber of Commerce. And so that's where I started to get my experience in Frankfort. And so learn a little bit of a different legislative process. And then, being the chamber, we worked on a whole slew of different issues from environmental regulations to taxes and all kinds of stuff in between. But I was able to really to sort of hone in on a couple of issues that really spoke to me, like childcare. I'm a mom of three. I have a 15-month-old, a 4-year-old, and a 6-year-old. And so that's what led me to work with some people at Metro United Way. And when this position opened up, it just felt like a great fit. So I'm really excited about the issues that I get to work on, which include childcare, maternal health, housing, criminal justice reform. And so those are sort of some of our big priorities this session and ongoing. But I'm really excited to be in this role and really come authentically into the space, into things that and be able to advocate for things that I really believe in. And thank you so much for inviting me. I'm excited to be here.
Am I the closer here? All right. Well, my name is Shane Nome. Great to be with you all this afternoon. I am the president and founder of Roebling Solutions. We're a full-service government relations and lobbying firm based in Covington, but we've got offices in Lexington, Louisville, and Frankfort as well. We're affiliated with Dinsmore and Scholl, a law firm. We are the contract lobbyist. So we're the hired gun that helps amplify what organizations do that have an in-house lobbyist or in-house government relations team. Often we're the ones that have the relationship with leadership. If you've done any lobbying before, you know that at the end of the session, it's really hard to get that meeting and really hard to get through. And we're the ones that help kind of smooth that part over. My journey has started right out of college. And actually, the month I was walking across the stage, I was managing a state Senate campaign in Bowling Green. And Senator Wilson is still the whip in the Senate. But I really came up through the campaign side of things. I worked for Senator McConnell for 8 years in campaign and official capacities and have built a deep bench of relationships on the Republican side of the aisle. Which is why I get interesting looks when I come advocating for childcare and advocating for solar and renewable energies and different issues that sometimes what I've found my clients have a hard time articulating those issues to Republicans. And I've really found a niche speaking Republican and conservative language on some of these more new and up and coming issues that they've not had to think about before. Talking about childcare as a workforce issue, talking about renewable energy as a support for the coal and natural gas industries. And so I really enjoy that side of it and kind of being the outlier amongst the conservative space. Thank you.
Thank you all. So as you all can tell, we have a ton of experience around the table in different realms as well. I know that it's likely all of our panelists know each other or know of each other or have maybe worked with each other on different bills or maybe worked in opposition of each other on different bills. So in Frankfort, it's a small community in some ways, and in others, it's, there's a lot of folks who don't necessarily intermix or mingle with other folks. So I got to ask one question because we always get this question from folks who are new into advocacy. What is the difference between advocacy and lobbying? Does somebody have like a hip pocket, really clear answer that they could provide folks?
What I like to say is anybody can advocate. As soon as you start getting paid for it, you're a lobbyist.
Yeah, we have been doing a lot of work at Metro United Way. We fund a lot of organizations in our service area and try to help them build advocacy capacity. And so, the way we really frame it with them is empowering them to tell their own stories, to tell their own lived experience. And then we can come in and help them with that.
I like that. Any other additions to that definition from folks?
Well, I'll just add that volunteer advocates like your students are really the juice that gets the job done, right? So we are all registered lobbyists, and my title is Director of Advocacy, but at the end of the day, it's the volunteer advocates who come in and share their time and their stories with legislators that really have that magic power.
Yeah. Thank you for that clarification. And I like the addition of each to really build out the understanding of that. I will remind folks to go ahead and drop questions in the chat as they occur to you. So just to lay out kind of where things sit within this legislative session, it's a 60-day session. It's a budget session. We are day 15 in, right? We're day 15. Okay, it's not, I forgot to tear off my page if we haven't. So we're like a little over a fifth of the way through this session, which sounds like a lot, but also has went very fast. So to our panel members, based on what y'all know and what you're seeing, what are the items or issues this session? There's always a couple of like really hot ticket items that the legislature is focused on outside of the budget, or maybe within the budget. What are those areas that you're really seeing and hearing a lot of conversation around, and that it's open to anyone?
Well, I'll start with something that I think is probably of interest to a lot of people on this call. And I think that there's a huge conversation happening around childcare as a workforce issue. As a lot of people know, there's federal funding that's lapsing, and it's been a really tricky needle to thread to convince legislators that we need state investment this time to uphold that system without without making them, they didn't do the original federal investment. So they sort of feel like they have an unfunded mandate to a certain degree. And so making the case for that as a workforce issue to support families and employers in the Kentucky economy, I know that's a conversation I've been having a lot of this session.
And I'm happy to build off of this. And Liz knows as well as anybody the reality of the childcare issue and the background to this. And I think this whole session is COVID. And I know we're all tired of talking about COVID, but the reality is there was a historic amount of funds available, and they came down to the states to be administered. And we had some really good sessions when it came to appropriations. Those funds are out or almost out, and it's not going to be as fruitful. So for the next 2 years, the legislature has the unfortunate task of saying, all right, who got the money? That was a stopgap to get us through the unknown. Who needs to continue to get that? And who needs to get cut back to where we were pre-COVID? And so they've got some really hard decisions to make. And I would agree that childcare is the biggest question mark over this session when it comes to the budget. You're always going to have roads, you're always going to have bridges and things that need funded, but the childcare crisis was exacerbated by COVID, and this is a problem that's going to last longer than these dollars are around, and we need to rethink about childcare not as an education system but as a workforce system. And I think that's a hard conversation, and it remains to be seen if we'll be successful this year in getting everything we're asking for, but the groundwork is being laid now to make a generational shift in thinking amongst our elected officials on this and other issues, such as time off, paid leave.
So I can jump in. One thing aside from childcare that I think hasn't caught as much of a buzz yet, but I think it will, given the other partners that are going to be stepping up to the plate and that kind of bring a bigger name with them, is last year we were able to pass House Bill 331, which requires the AED, the cardiac emergency response plans, and the AEDs in schools. And this year we're looking for funding in the budget to support schools and in meeting those requirements. So the partners that are willing to step up to the plate are the NFL, the NBA, and then all of the Kentucky sports teams. So we'll be having a big press event coming up soon to help kind of push the legislature to fund that requirement for schools. So I think, that hasn't caught a lot of traction yet, but I think it probably will as the session moves on. Because it's a big ask for schools. to put those AEDs, in place to make sure that they're well equipped to save these students that go into cardiac incidents.
And
Shannon, what about lung? Yeah.
I'll just add health as a umbrella term for what I think is an encouraging and growing genuine interest among lawmakers in addressing what is a tremendous challenge for Kentuckians and lung health in particular. I mean, I don't know if everyone knows, but the fact is we have the highest lung cancer incidence and mortality rates in the entire United States. And I think that has really been a jaw-dropping realization for some lawmakers who started out talking about smoke-free campuses a few years ago, school campuses, and then over time talked about biomarker testing and what can we do about lung cancer screening rates. And Kentucky ranks among the top 5 in the nation for our good work with screening high-risk individuals for lung cancer. And that's so important. Early detection is the key to saving lives. And then, and building on that, again, the biomarker testing bill that allows coverage for the test that determines the particular tumor type an individual, a patient might have, so that the targeted therapy can specifically address that particular tumor type and increase outcomes and improve lives going forward. So I'm encouraged by that and even some discussion, dare I say it, around tobacco control in the state of Kentucky. And we'll get to that maybe a little bit later, but I'll stop there for now.
Yeah, well, I know that Shannon and Ashley, we are working with you. My colleague Alicia Watley is working closely with you all on some items that we can dig in a little bit. But Shannon, what you were talking about as far as some of the more granular items that you all are looking for also reminded me of what Shane said as far as like getting the message to legislators. And what I think a lot of folks struggle with is like, how much detail with legislators do you go into, especially if they don't have any understanding of like lung health or childcare or kids' mental health? Like, how do you balance the messaging but then also get specific enough to make an ask? What does that look like?
So I'll circle back to my earlier comment about the power of the volunteer advocate's voice. So it starts with your story, doesn't it? It starts with why you personally are sitting in a lawmaker's office having that conversation to begin with. What is your personal connection? Because the statistics are the statistics, and they're important. But it's the story, it's the personal connection that lingers in a lawmaker's mind. And so starting there and then sharing that one or two bits of information or statistics that really are powerful and compelling. And to me, to go into a lawmaker's office and to be able to say, sadly, Kentucky has the highest lung cancer incidence and mortality rates in the nation. So what we're about to talk about isn't more relevant or important anywhere in the country than it is right here in Kentucky, is a sort of an attention getter. And then so for example, today we had a radon education day at the Capitol, and lawmakers came in to learn about radon. And most people know that smoking is the #1 cause of lung cancer, but most people don't know anything about radon. Least of all, that it's the second leading cause of lung cancer, and it's present in 44% of Kentucky's buildings at elevated levels that should be mitigated to protect our families from lung cancer. And so that's a long-winded way of saying, start with your why. Am I here? Start with how is this relevant to you and here in Kentucky, and then drill down.
I mean, I think Shannon brings up the best point. We all come at this. I mean, I listen to my colleagues here in the Capitol and in the annex walking around, and everybody has a legitimate ask as to why they're here. I mean, we're all competing over funds. We're all competing over resources with very most of the time, very reasonable asks and very legitimate stories, right? So I think the key is to find, like Shannon indicated, that one story or that one piece that is really going to stick out in that legislator's mind. And I think sometimes, it gets strategic where it's like, okay, can you find, an advocate from that legislator's home district? That's helpful. But, you know, so many times, like when we're working on a youth related issue, bringing kids to the Capitol and having the kids speak from their hearts and not all of these pre-canned talking points. It's really helpful when people come and just simply share their true heartfelt stories, because these legislators hear from us, they hear from Shannon, they hear from Liz, they hear from all of us every day. But when they hear from folks from their communities, it's really, really helpful. And I don't think we can stress that enough. So to make our everyday citizens advocates, that's the key.
I agree. I think those are great points. The other thing that I'll touch on is, I think so for childcare, for example, or for maternal health, the people who are working on those issues it's sometimes hard to sort of edit down or get to sort of the key message there. And so that's where I think it's important to, when you're thinking strategically, like you try to narrow in on sort of a legislator who's a champion for that, either on the committee or in that chamber. And then it's helpful when they can really, when they know all the information about it too and can help to educate their colleagues. But you don't, like for childcare, there's a lot of really sort of like technical jargon and ask within that. And while we want support from everybody, not everybody needs to know about the 5 different programs that CCAP funds and the federal regulations. You need your handful of champions who understand that and are in the weeds. And then you need to be able to sort of broadly tell that story with other people. And that's, especially where getting a childcare provider or a family that can access that childcare assistance program, the subsidy program, to talk to their representative is really helpful.
I've got 2 approaches, and then I've got a kind of a third that I'll mention. So one is during session, I use kind of a laser focus. I go in and I've only got them for 5 minutes to 15 minutes if I'm lucky, and I want them to remember the one thing. But when we're in the interim, when we're out of session, I throw spaghetti at the wall. I throw as many little things that are in digestible sound bites as I can to see what sticks. And then I have to listen and see where they perk up and what legislators respond to, because that is what will give me a good follow-up opportunity to come back and say, oh, you have an interesting experience with childcare in your community. Let's circle back on that when I see you at a reception or next time we meet. And that could be a lane in to have a further conversation. But very much at this point, I'm going in with my 30-second soundbite, 1-pager, get in and get out, and then follow up by email. The other thing is, I was going to say, don't always take no as a bad thing. No doesn't always mean no in this case. And I'm thinking of a client that I went in for. It was a solar company, and we were going into the heart of coal country. And I know there had been some solar projects that were started up and then failed because of property rights kind of conversation. And we went in, he went in, the legislator and I went in kind of with the understanding, I know where you are, you know where I am. Now, we also know there's a crisis in the energy space. So let's talk about the realities. I'm going to vote no on this. He said that right off the bat. I'm going to vote no on this, but we're going to talk about this in caucus. And I don't think you're wrong. And I want to help defend your point, even though I'm going to vote no because I have political realities. So recognizing no doesn't mean no, and there's political realities that they're going to live by, that you can use that to your advantage, where publicly it might look like a loss, but and the cause knows that you helped to get to a win through backdoor and back channel work.
Shane, you bring up a really good point. And I think that's, when we have these meetings, these legislators do operate within political realities. So I think we as advocates or as lobbyists, truly as advocates, you come in with your personal experiences, and it's really important and really hard sometimes to remain neutral and to remain respectful. But I think that is so important. And it's becoming, I think, harder as the years go on sometimes. But it is really, really important. The other thing I was going to mention was something else, Shane, that you said. Oh, I'm losing my train of thought. It's been a long day already over here. We're all over here running the halls. It'll come back to me. I'll mention it. Sorry.
We, as advocates, need to give ourselves some grace at 3:30 in the afternoon because some of us have been doing this for quite a few hours today. Liz, were you going to jump in with something?
Yeah, just to sort of piggyback on what Shane said in the comments, not to burn bridges, when you're advocating on multiple issues, or, multiple policies, we might oppose something around criminal justice but want to keep the lines of communication open with that sponsor because we need their support on childcare and maternal health. So there is, you have to sort of be comfortable with tension, not attention, but that too. Because it's important to maintain these relationships, but you're not going to be in agreement all the time.
Yeah, such good nuggets of wisdom from all of you just now. I really appreciate that. And I think the connecting thread there is the relationship building, the relationship facilitating, the maintenance of it. Those are all really important. So I know KYA has been in a position where we gave a very public award to a legislator, and then the very same day he filed a bill that was not something that we were thrilled about, to put lightly. So we're trying to figure out how to navigate lifting up and really applauding that good work, and then also trying to figure out how to have a conversation with the same person and say, like, this is terrible for kids because of XYZ. I wouldn't say it that way. But trying to communicate why you're concerned about what they had just filed may cause some harm for specific groups of kids. So that relationship piece is tenuous sometimes. And the political realities of legislators voting a certain way, even if in their hearts they really don't want to, but they have to because of the other things that are floating around. So I think it's just remembering. We had a newer advocate earlier in a session say, like, I had a bad experience with a legislator. That legislator was rude to me, and I don't know how to come back and have a conversation with them. And, we got to remember that people are people and they have bad days and they say things that are inarticulate or sometimes hurtful. But at the end of the day, and I've been on both sides of that, I think, and at the end of the day, it's remembering that we still need them to make decisions based on what we're hoping to see them make decisions on. And they are still in the seat to do that. So I really, really appreciate everything that you all were kind of enlightening folks on, because I think when you do this on a regular basis, you sometimes forget how tricky it can be to enter that space. I've got one more question, and then I would like to open it up to folks if they've got questions that are in attendance here, if that's all right with you all. The question I have is, like, what are you hoping to see get across the finish line that you haven't already talked about this session? Like, what are you really hopeful actually makes it happen this session, whether it's a budget priority or line item or a little known bill? Is there anything that you're really gunning for?
So Shannon probably saw me come off mute right away, and she smiled. I saw her smile. So one thing that Shannon Moody, you guys are helping us with, and Liz, I know you guys are on board with this as well. So one of the things that we're working on this session is hoping to protect youth with this whole youth nicotine addiction issue and their access to nicotine products. So kids are not supposed to be able to be sold these products at retail locations, but we know it's happening. So we have a fantastic Tobacco 21 law in place, both federally and at the state level, but we need an enforcement program. And so that's what we're kind of shooting for here. We would really like to get that over the finish line. We're working on it. We have an event coming up on February 15th. We're going to have kids here at the Capitol walking around and meeting with legislators, hoping that they can, use their voices just like many of you all do. and sharing their stories, because we know that this is such a huge issue in our schools, and in homes, but really in schools a lot. We hear that from our administrators and our superintendents. So we're just trying to bring focus to that and trying to crack down at the retail level.
I'll share two priorities I'm working on, and remember, I'm the hired gun, so whatever I'm hired to do is what I advocate for. One is a prize catfish bill. So there's a group of sportsmen that would like to see the end of transporting live catfish, that they're planning to put in a pond or somewhere else and just leaving them in the river as is, so that you can fish for them over and over again and not take them out of that pond. Didn't know that that was a hot button issue, but apparently Owensboro is fired up about prize catfish. And then in healthcare, there have been a lot of conversations about good health and good healthcare, are two different conversations, but we need both in Kentucky. And what does that look like? What does the system look like that we need? There was a task force over the interim on certificate of need reform. And that task force, it's been proposed to re-up that. I do have a client interest in that, but I think that's a very fascinating conversation. These laws haven't been changed since the late 60s, early 70s. Healthcare has changed a lot in that time, and Kentucky has changed a lot in that time. And so I'm glad they're continuing the conversation. Proponents of reforms don't see that as a loss. They see continuing the conversation as a good thing. So I'm anxious to see, if not this session, next session, some movement on certificate of need.
I had no idea you were the catfish man, Shane. You contain multitudes. We are also watching the certificate of need conversation, particularly as it relates to maternal health. We have been supportive of an exception to certificate of need for birth centers, particularly in our service area. It's a health equity issue. And we know that there are a lot of minority populations that have had difficult experiences with healthcare professionals. And so being able to support them with options for maternal care is really important. And maternal care is one that I mentioned a little bit, but that's something we're putting a lot of effort into this session as well. There's a couple of really exciting bills that have been filed. House Bill 10 is Brett Moser's bill in the House, Herm Omnibus, and then Senator Westerfield has SB 34, which I think is like $500 million that has some childcare and maternal health. But we're excited about the focus around that. Kentucky has some really dismal statistics around maternal and infant mortality. And so making some policy changes that would allow women to access maternal and prenatal care is something that could really help to move the needle. And excited to be a part of that conversation and hopefully get some good policy over the finish line.
And so I'll just add to, in addition to what Ashley talked about actually enforcing the law that's already in place that prohibits nicotine sales to people under the age of 21, we also need to talk about youth prevention and cessation. And so kids who have already begun using these e-cigarette products need and want help quitting, and that requires funding. And it also requires funding to educate students to prevent them from ever initiating. If we keep a person from using a nicotine product before the age of 21, they will probably never initiate use of these deadly products. And so the funding piece is for the state tobacco control program that does both of those things, that supports both prevention and cessation efforts through the quit line and education in schools, et cetera. And so we are working in this budget session to try to increase funding for that program.
And I know that KYA is engaged in conversations around a lot of what you all brought up, and especially when it comes to helping folks understand that prevention and intervention, or prevention and cessation, are really important for our young people. And the way in which we hold young people accountable also needs to make sense for getting them to consider quitting, right? Because we're seeing some bills that are filed that have some problematic juvenile justice responses around vaping and nicotine use and cessation and prevention. So we're always looking for ways in which to address the issue, the core issue, right? And not get kids involved in systems that maybe they don't need to be involved in. We did not get super into defense, but we did talk about the relationship piece, right? And like balancing how to still go sit with somebody across the table and have a conversation and maintain kindness and maintain an open line of communication. I don't see any questions in the chat, but folks are very welcome to come off of mute and ask questions or to submit them in the chat and I can read them. Or if you're like, my mind is blown, I know everything I need to know, that's okay too. But I wanted to make sure we had an opportunity for questions.
I have a question.
Yeah, Judy.
Hey, hi everybody. Sorry it's late. Do you think it really helps to tell them when you think it's a super bad bill, which I could mention a few, but if you're calm and have, does it even help if you have other data that they might want to consider, or is that just forget it? Don't do it.
Yeah, it absolutely does, but I think it's how you present it. They get told every day via email and angry messages and Facebook messages and people showing up to their house when they come home that that's a bad idea, don't vote for that. So if you have a relationship with somebody and you think something they're working on is a bad idea, it is very impactful if you go sit down with them and have a very calm conversation. Hey, I know you're fired up about this, but I just want you to know these are the consequences if that happens. And sometimes they'll say, yeah, I don't really want to carry this. I'm not going to work real hard on it. But I was asked to file it. And you'll realize where they're coming from. Or you might change their mind and they might at least consider your perspective that they otherwise wouldn't have. It's absolutely worth it. Just got to know that context and the time and place when best to do it.
Thank you.
Yeah, I agree. And I think that, sometimes like coming with alternatives or alternative language, sometimes they might file something and not realize that it has an unintended consequence for a local mandate, or it contradicts with some other local laws. And so respectfully and constructively having that conversation, pointing that out, trying to stay in conversation with them and try to work to make it better, I think is worthwhile.
Thank you.
Really solid points. We had a meeting with a legislator today that we don't have a relationship with, but we're working on it because that person is newer. And we came with really clear, concise, just three, it's big bill, but just three changes that we wanted to see with solutions or recommendations on changes, because we can't tackle everything. Not everything is in our wheelhouse anyways, but they sat down, they listened, they said like, nah, we're not even considering that. But then there were also other parts of it where they were like, we hadn't thought about that. I think we could take that back to the team and discuss. So, yeah, giving that feedback can be tricky when you don't have a relationship, but having alternatives is helpful.
When I think we as an organization could take our own advice sometimes, but being willing to accept incremental change sometimes. We all go in with our pie in the sky answer to things and we want things a certain way, but understanding that these legislators, like I said earlier, they're people too, and they're all facing, political realities. So there are a lot of nuances involved that maybe we aren't even aware of sometimes. And so if we can take these incremental steps, and so maybe this session pass X, and then 2 years from now, or 4 years from now, or 10 years from now, come back and pass Y and Z. So it's, being willing. And one of the reasons that I mention this is I've been involved in the animal rescue world forever. And I always sit and shake my head because, the folks that I've worked with in that realm, and I don't do that professionally over here, but just, the groups involved in that, they want all or nothing. And so we get nothing. And that's, it's frustrating. And that's where, if I were to counsel people in that regard, it's like, be willing to take small incremental changes, and you really will make progress year over year if you're not coming in asking for everything all at one time.
That's a really good point, Ashley. Somebody brought up paid leave earlier, and that bill passed the House yesterday. Is that right? HB 179, Rep. Haverin's bill that would it's voluntary, but it would allow employers to offer paid leave or to buy into it as an insurance product. And I'd love to see eventually mandatory paid leave, but I also recognize that that's not going to happen all at once, and that this is a great incremental first step and we can build on it. So I just think that that's an example of how that works. Policy advocacy is a long game, and it's frustrating and disheartening sometimes, but and the changes are often incremental, but it's worth it to stay in the process.
And I'll just add that there are occasions, and they're difficult ones, that sometimes a bill is just irredeemable. And sometimes you have to navigate the tricky waters of saying, I'm sorry, but your baby's ugly. It's not an easy message to deliver, but Shannon mentioned penalties around purchase, use, and possession of nicotine products for kids. And sometimes it's necessary to stand on evidence-based policy and solid moral grounds. And we all know that kids have been intentionally targeted and lured and addicted. And then punishing the victims is just ineffective. We're not going to chase this problem out of Kentucky one kid at a time. And it's wrong-minded, and it's morally wrong. And sometimes a bill just can't be fixed, and you have to oppose. And there's that too. And a fun fact, just a quick aside, Ashley and I are working on a local ordinance that is wrong-minded, and we have to say so. But that particular local council member who is sponsoring the proposal is married to a very powerful state senator who is a friend to the Lung Association and to the Heart Association. And this circles back, Shannon, to your comments earlier about sometimes it's tricky, and sometimes it's how you deliver the message or who delivers the message. And you have to navigate those waters too once in a while.
Yeah.
Kentucky is a small state, Shane.
That is spot on. And people do not forget when they are mad about something. Remember that. So you all have been just incredible. I so appreciate all of the insight, all of the really good practical tips. And then also what I think I heard was like, stay optimistic or stay at it or stay positive. I don't know. Be resilient because it is a long game. And if you want to see change happen, it's generally incremental. And yes, live, laugh, love. Thank you all so much for being here. Any other like last minute, like, ooh, I had this on the tip of my tongue and I want to share it before we close out. Do you have a question, Kenzie?
Yeah, so sorry for being late. Also, I had an appointment that ran over with a client. This may be, I'm still learning the ways of like social policy and how all of this kind of works. So you'll have to excuse me if this is a little, I don't know. But is it helpful to, I know you already do research like beforehand when you're like proing against a bill and stuff, but like looking at the prison to school pipeline and like how that bill would affect that and increase that, especially like with like, especially because we know the prison to pipeline affects the Black community more, like would it be worth to do like hypothetical research of like if this was passed, this is how this would greatly affect different populations in Louisville, like specifically Louisville, because we know that kind of like affects Louisville a little bit more. And do you present them with research, or is that kind of something that you don't really do? Like if you were to kind of gather and be like, this is what this would directly affect and how it would affect these kids, and this is where we're coming from, or is that not something you do, like with the senators and stuff?
I can take a stab. So data is always helpful,
Mhm.
especially leadership. Leadership will want to see where's the data on this. When it's appropriations, they're going to want to know, show me that this program works before we give you $500 million or something astronomical, which is what all of our requests are. But I think it was said earlier by several of my colleagues on here that the anecdotal stories are so much more impactful. I can put the best white page document up there and says everything factual and how exactly this is going to work. But if I've got somebody who's got a lived experience sitting right next to me, nobody's going to read this document, but they're going to listen to this real story and this narrative that's right in front of me. And so you got to balance, is the cost benefit there on commissioning that study and putting all that time into a paper that's going to go on a shelf and might be read, might not be read? Or can we find the stories that are going to be the most impactful? And that's really just a balance of your organization and resources.
That makes sense. Thank you.
It also matters how you present it, I think. And so if you present a legislator with a tome of information, it's not likely to ever be read. If you present a lawmaker with an infographic that has some hard-hitting facts on it, you'll have a better, I think, outcome.
Good question, Kenzie. All right, you all. Thank you so much for dedicating the time today. I know that your all's inboxes are probably destroyed just being away from them for 45 minutes. So please take care. Have a good rest of your day, and thanks for joining us.
Thanks, Shannon. Bye.
See ya.
Thank you.